Hello everyone and welcome back to another discussion. Today we're going to dive into one of the most important international organizations in the world, the World Health Organization, commonly known as the WHO. So what exactly is the WHO? The World Health Organization is a specialized agency of the United Nations, UN, that is responsible for international public health. It plays a central role in coordinating global responses to health crises, setting standards, and guiding international health policy. The organization's mission is simple yet powerful, to ensure the highest possible level of health for all people, everywhere. Health, according to WHO, is not just the absence of disease but a state of complete physical, mental, and social well-being. This broad definition highlights that health goes beyond hospitals and medicines. It involves everything from clean water and nutrition to mental health care and disease prevention. Let's take a look back in time to understand how WHO came to be. The WHO was officially established on April 7, 1948, which is now celebrated every year as World Health Day. Its creation followed the devastation of World War II, when the world realized that global cooperation was absolutely necessary to tackle cross-border health issues. Before the WHO, there were already attempts at international health cooperation. For instance, the International Sanitary Conferences were held in the 19th century to deal with cholera and plague outbreaks. Later in 1907, the Office International de Hygiène Publique was created in Paris. And in 1923, the Health Organization of the League of Nations was formed. These earlier efforts laid the groundwork, but they lack the global reach and authority of today's WHO. When the United Nations was founded in 1945, its member states agreed that a global health organization was needed, and so the WHO was born 3 years later. Since then, the WHO has been at the forefront of major health achievements. One of the biggest milestones was in 1980, when it officially declared that smallpox had been eradicated, the first disease in human history to be completely wiped out by human effort. The WHO's work is incredibly wide-ranging. Here are some of its main functions. Disease control and prevention. From tackling outbreaks like Ebola, SARS, and COVID-19 to working on HIV, AIDS, malaria, and tuberculosis, the WHO helps countries respond quickly and effectively. Vaccination campaigns. The WHO coordinates large-scale immunization programs worldwide. For example, the fight against polio is a joint effort led by the WHO and its partners. Research and standards. The WHO sets international health guidelines, from safe drinking water standards to air quality recommendations. Emergency response. During crises such as earthquakes, floods, or pandemics, the WHO provides technical expertise, supplies, and coordination to save lives. Health policy and advocacy. The WHO helps governments design better healthcare systems and promotes universal health coverage. Did you know that the WHO Constitution was the first international agreement to state that health is a fundamental human right? The World Health Assembly, WHO's decision-making body, meets every year in Geneva, Switzerland, where 194 member states come together to set global health priorities. WHO has 6 regional offices in Africa, the Americas, Southeast Asia, Europe, the Eastern Mediterranean, and the Western Pacific, to make sure its work reaches every part of the globe. In 1988, there were 350,000 cases of polio worldwide. Thanks to WHO-led vaccination efforts, cases have dropped by more than 99%, and polio is close to eradication. During the COVID-19 pandemic, the WHO played a key role by coordinating vaccine research, providing global guidelines, and running the COVAX program to ensure vaccines reached poorer countries. The WHO doesn't just deal with infectious diseases. It also focuses on non-communicable diseases like diabetes, heart disease and cancer, as well as issues like mental health and substance abuse. In summary, the World Health Organization is much more than just an institution. It is the backbone of global health cooperation. From eradicating smallpox to battling modern-day pandemics, from setting safety standards to championing universal healthcare, the WHO continues to shape the health and well-being of billions of people around the globe. The challenges of global health are always evolving, but with organizations like the WHO, the world is better prepared to face them together. And that wraps up our deep dive into the World Health Organization, its mission, history, and impact on global health. From eradicating smallpox to leading the fight against modern pandemics, the WHO continues to remind us that health is truly a shared responsibility. If you found this video helpful, don't forget to like, share, and subscribe for more discussions on global organizations, history, and human rights. Also, drop your thoughts in the comments below. What role do you think the WHO should focus on more in the future? Pandemics, mental health, or universal healthcare? I'd love to hear your perspective. Thanks for watching, and until next time, stay informed, stay healthy, and take care.